Hi everyone, Liz from 222 Health and Social Care here, joined by Lynn. Hi Lynn.
Hi everyone.
So this lunchtime we are doing BTEC National Health and Social Care revision on Unit 3, Anatomy Physiology, today focusing on the Cardiovascular and Respiratory Systems. So let's load up our PowerPoint. We have lots to get through today. Hopefully those of you at home, school and college are going to join in. Please make sure you're a subscriber to our channel so you can type your answers in the chat. We'll have a series of activities where you can tell us your answers. So let's get straight to it, Lynn.
Yeah, brilliant. Okay, so let's see what our first question is for this afternoon. So this is a what's the difference activity. So we need you to tell us what the difference is between these two concepts that you can see on the screen. So what's the difference between the pulmonary circulation and the systemic circulation? So what do we think? What's the difference between these two concepts that you can see on the screen? You might just want to give us a feature of one of them or a feature of both of them. Could you explain the difference? Okay, give people a little bit of time to think about that.
Shall I give a clue, Lynn, that pulmonary is a term that links to the lungs?
Yeah, nice. Yeah.
And systemic generally indicates the whole of something, so the whole body. Hopefully that will help people.
Yeah, nice kind clues there, I think, Liz.
Got to warm everyone up.
Yeah, exactly. Straight in on anatomy and physiology today. These concepts can be quite tricky.
They can, definitely.
So do write your answers in the chat if you think you know, or even if you just know what one of them is. Share with us your thoughts.
Shall I reveal the first one, Lynn, so we can talk through it?
Yeah, I think let's do it.
Okay, so the pulmonary circulation is what carries deoxygenated blood from the heart to the lungs to get oxygenated and then returns that oxygenated blood to the heart. So it's the short part of the circulation between the heart and the lungs. Okay?
Yeah, brilliant. That's how I'm going to remember it. What about the systemic circulation then, Liz? What's that in contrast?
So in contrast, the systemic circulation is transporting that oxygenated blood from the heart all around the body and then returns the deoxygenated blood back to the heart, where it then goes into the pulmonary circulation to get oxygenated.
Brilliant. So two really important concepts there. And remember, you can always watch these back as well, so that can be quite handy.
Absolutely.
To revisit them.
And I will put the PowerPoints on the website as well.
Yeah, brilliant. Shall we have a look at our next question? Yep. So here we've got a question that says, which of the following are ways that the heart rate is regulated? So there's a number of these ideas here, and which of them relate to the ways that the heart is regulated? Not all of them do. So look at them one by one and think, does that relate to the heart being regulated, or does it relate to something else? And maybe in the chat, if you can join in, just write, an example might be B3 or C1, for example. So just pop in the chat which one you think might relate to this question.
So to answer this, Lynn, my immediate kind of strategy would be to rule out ones that I know are definitely not related. Yeah. And there's one that keeps jumping out at me, which is A2, the liver controls the heart rate. I know that is not right. Look, we've got an answer for the previous activity. So C. Varga is saying pulmonary is heart and lungs, systemic is heart to the whole body. Yeah, brilliant. Thank you. I think that's a teacher, isn't it? So well done to that class.
Yeah, well done, class. So now just give us any of these that you think might relate to the ways that the heart is regulated. Liz already has ruled out A2. So
also linked to that, Lynn, the one straight above it, A1.
Yeah, that's the one that I'm not feeling.
I'm also thinking that's not right. The kidneys regulate oxygen levels in the blood. I know that's not the case. So those two I'm definitely ruling out.
Okay. See if anybody wants to tell us what they think. Otherwise, I might get you to tell us your thoughts, Liz. Could reveal the answers.
I'm also thinking, Lynn, that B2, the small intestine, absorbs nutrients to increase heart rate. I think the small intestine does absorb nutrients, but that's not the purpose. The purpose is to provide nutrition to your body. So I think that one is wrong as
We're
well.
going to rule that one out as well. Yeah.
And then the other one that I would definitely rule out is C3, the spinal cord processes signals to adjust heart rate. The spinal cord transmits signals, but as far as I'm aware, it doesn't do any processing. That happens in the brain. Shall I reveal the correct ones?
Yes, so what does that lead? Let's see if you're right then, Liz. Let's reveal the answers.
Yes.
Yes, well done.
So we've got adrenaline increases the heart rate. The parasympathetic nervous system decreases the heart rate. The sinoatrial node, the SA node, acts as the heart's pacemaker. So that's actually inside the heart. Chemoreceptors respond to changes in oxygen, carbon dioxide and pH levels. Yep, and baroreceptors detect changes in blood pressure. Yeah, there we go. So this can be quite complex. I recommend that you spend some time kind of reviewing this and also looking in your textbooks or your notes to make sure that you're clear about how the heart rate is regulated.
Yeah, really nice. Some good examples there. So ignore all the ones in white. We don't want you to get confused.
Yeah, they're incorrect.
Yeah, they are incorrect, the ones in white. You just want to note the ones in yellow. Okay, brilliant. Should we have a look at our next activity? We've got another what's the difference? Okay, so what's the difference between these two concepts? We've got the atria and the ventricles. What are the difference between those parts of the body? What do we think? Oh, see, Varga, I think we're on a bit of delay because they've come back with their answers now. So it might just be taking a little bit of time to come through. But looks like you guys were correct in what you said in those anyway. So well done, C. Varga's class.
Let's give them a round of applause.
Yeah.
Okay, so maybe if we just give them a little bit of time to catch up. So the difference between the two concepts, atria, ventricles. So these are structures in the heart.
Yeah.
So we have 2 atria and 2 ventricles in our heart. What is the difference? So first of all, we need to think, well, what are they? And then you should be able to work out the difference from there. So think about the diagram of the heart, think about what you know about the structure of the heart, and work back from there, I think.
Yeah.
I'm sure that C. Varga, I don't know if it's a miss, a mix, a Mr. Varga. I'm sure they're talking about this in their class right now.
Yeah. And a sort of key skill really in health and social care is to know the meaning of key terminology, obviously, and to often be able to describe the difference between that and something else. So and in Unit 3, Anatomy and Physiology, there are so many key terms, and some of them are quite a mouthful, aren't they, Lynn? They're quite tricky. Yeah, definitely. But you don't necessarily need to know how to pronounce them.
Exactly,
you just need to know how to write about them and explain them. So spelling is more important than pronunciation with these.
Yeah, and I mean, remember that your spelling is not actually marked in your Unit 3 exam. However, the examiner needs to know what you are giving as your answer, so you need to try your absolute hardest with your spelling. Shall we talk about the atria? I'm sure that C. Varga's class is going to give us some answers in a mo. So the atria, or the atrium, you've got a right and left atrium. So the atrium is the singular, atria is the plural. They are the upper chambers of the heart that receive the blood returning to the heart. So either oxygenated blood that's come from the lungs or deoxygenated blood from the body. So remember what we said about systemic and pulmonary. So the oxygenated blood is coming from the pulmonary circulation into the atria. The deoxygenated blood is coming from the systemic circulation into the atria. So they're the upper chambers. So then the ventricles, Lynn, are your lower chambers, yeah?
Yeah, because that's the key difference, isn't it? Upper and lower. Yeah.
And they're the ones that actually pump the blood out of the heart. I can see that C. Varga is saying, atria at the top of the heart, ventricles at the bottom. Brilliant, Brilliant. So the lower chambers of the heart are actually the ones that pump the blood out. So either to the lungs to get oxygenated as part of the pulmonary circulation, or to the rest of the body to supply oxygenated blood. Okay, let's move on because we do have loads to get through. So now we want you to give us 4 components of the structure of blood. So 4 things that you find in blood. It seems a bit weird to say the structure of blood, but that is what we say, the structure of blood. Oh, Mrs. Varga. Okay. So
Mrs. Varga.
Mrs. Varga's class, 30 seconds to tell us the 4 things that you find in blood, and then bonus points if you can say what any of those elements or components actually do. So let's give you a timer.
And if you can't think of 4, don't worry, just give us 1 or 2. Okay, so we've got a lovely answer here with from Halima, who's talked about plasma, white blood cells, platelets, and hemoglobin.
Excellent, very good.
Yeah, so well done. Shall we have a look to see what we got there? I think we might have a little bit of explanation alongside ours as well.
Okay, so we have red blood cells, which are called erythrocytes. These are disc-shaped cells without a nucleus. That's really important because that gives the blood cell more space to carry oxygen using hemoglobin. Then we have white blood cells, which are known as leukocytes. These are a diverse set of cells with nuclei, and they're involved in defending the body against infections and foreign substances. Then we have platelets, which are called thrombocytes, and these are small cell fragment-like structures which are essential for blood clotting, which prevents bleeding. And then we have plasma, which is the liquid component of blood that carries nutrients, hormones, waste products, and other cells throughout the body. So Halima, you're definitely getting a round of applause. Well done.
Yeah, well done.
Just a point on the terminology here. I think when an examiner is marking your Unit 3 paper, if you said red blood cells, you would get a mark if that was relevant to the question, or if you used erythrocytes. So if you can't remember that key term erythrocytes, red blood cells is sufficient. Same with your platelets and your white blood cells. So, if you know those terms, use them. If not, then, what you've said is fine. Oh, Halima's saying, I'm with my class, we're answering together. Brilliant. Well done, Halima's class. Yeah. Fabulous.
Well done. I think we could give them an air horn.
Yeah,
Let's do
that. Yeah. Any excuse for the sound effects. Okay.
Exactly. Well done.
Let's have a look at the next one. Okay, another what's the difference, Lynn?
Yeah, so this time we've got arteries and veins. So what's the difference between these two concepts? We talk a lot, don't we, about arteries and veins and the blood flowing through, but what's the difference between them? Think about what they are and how would you describe them so that we've got some clear differences between the two.
Brilliant.
So give you a bit of time. Halima, you're taking control for your class. So
I was going to say, Mrs. Varga said Mrs. Varga's class have answered the previous one correctly, so well done.
Oh, brilliant. Yes, excellent answer there from C. Varga's class.
Okay, Sophia says arteries carry arterial blood. Can you give us any features of arteries that make them capable of carrying arterial blood? And then Manima, arteries, I think that should be carry blood away from the heart, oxygenated. Veins take deoxygenated blood into the heart. That sounds like a good answer to me.
Yeah, definitely. And maybe similar to what we maybe have here.
Shall we have a look, Lim?
Let's have a little look. So you go on, you go, Liz.
Arteries carry the oxygenated blood away from the heart to the body. And the features of them that enable them to do this is because they're under high pressure, they have thick elastic walls. So the lumen, if I can show you the circular structure, like the tube, is quite thick and elastic so that they can flex under pressure. And then veins, as Manima said, they return deoxygenated blood to the heart. They're under lower pressure, so they can have thinner walls. And veins actually have valves in them to prevent backflow. So if you think about you've got to get the blood from your feet back up to your heart. So the valves mean that the blood can only flow in one direction, so it doesn't all just drain to the bottom of your feet, because that wouldn't be very good for our brains.
Absolutely not. So some nice description there about the difference.
But well done, everyone. Let's have a round of applause.
Yeah, well done. Excellent.
Okay, let's see, what do we have next? Okay, so over to you.
Yeah.
Lynne.
Well, no, I was just going to say we're sticking with blood here. So we talked about the blood and described it and what makes up blood, but we're very keen to know the function now of blood. So we need 4 functions of blood in the chat, please. We've got, I think, 30 seconds on the clock for you. So Sophia, it's already started us off. So let's see if everyone else can catch up. Let's go. 4 functions.
Oh, we've got no music. Don't know what's happened to my music.
You can see the clock ticking here.
It's going really fast.
Okay. I know, it feels like quite fast, 30 seconds, everyone.
Oh, it's still
maybe
going.
It's giving us a minute.
Oh dear.
Yeah, maybe it's a minute. 30 seconds, but on a minute clock.
Yeah.
So what's the function of blood in the body?
Oh, it's stopped now. That's all right. I thought it was going to carry on.
Okay, so we've got 2 nice answers here. One is that carries oxygen, and then we've got platelets in the blood, clot the blood, help to clot the blood.
Okay.
Any other answers?
I can see Mrs. Varga's class answer to the previous question. Arteries carry oxygenated blood, have thicker muscular walls. Veins have deoxygenated blood and valves. Yeah, brilliant.
Lovely.
Shall we have a look at our answers for the functions of blood?
Got. And I'm sure when you see them, you'll be like, oh, yeah, this makes sense. Very important functions. So look at all those lovely functions. So we've got transport. So blood carries oxygen, nutrients and hormones to cells and removes waste products like carbon dioxide and urea. So transport is one key function. Okay. And then regulation is another function of blood, because it can help to regulate body temperature, pH levels and fluid balance to maintain homeostasis. And we talked about that last week, didn't we? And then protection. A very important role in terms of protection, because our blood contains those white blood cells and antibodies to fight infections, and platelets, as Sophia's talking about here, to help with clotting and wound healing. So when we injure ourselves, it helps us heal quicker. And gas exchange is the last function we have here, because blood transports oxygen from the lungs to tissues and carbon dioxide from tissues to the lungs for exhalation. So 4 very important functions of blood. I think that's an important area to revise, isn't it?
Absolutely. Also, I think it's quite important, the the link between the cardiovascular and the respiratory systems. Yes. So we've said about pulmonary and systemic circulation, and now we're talking about gas exchange. So oxygenating the tissues and then removing waste products. So those 2 systems work really closely together. Okay, let's have a look at our next
make those
activity.
Connections. You're kicking goals, I would say.
Okay, so now we're on to some cardiovascular disorders here, aren't we? So I'm going to get Lynne to read out some clues to help us guess whether we are looking at A, stroke, B, hypertension, C, coronary heart disease, or D, anemia. Okay, Lynne, read us our first clue.
Okay, so which condition is this? It develops over many years due to the build-up of fatty deposits in the blood vessels. Okay, that's interesting. So
type your answer if you think you know.
Yeah, just pop A, B, C or D in the chat if you think we know which one this might relate to.
Should we go for the next clue?
Yeah, I think so. Risk factors include smoking, high cholesterol and a sedentary lifestyle. So I'm feeling like that is quite a risk factor for many of those conditions.
Yeah. Sophia is saying C, coronary heart disease. Shall we give her another clue?
Yeah, another clue and see where we are. It can cause chest pain due to reduced blood flow to the heart. So I'm feeling like Sophia might be on the right track here.
I think so. Final clue.
This condition is the leading cause of heart attacks in the UK. And I think we'll give Sophia a round of applause for getting coronary heart disease very early on. So lots of key features of coronary heart disease there on the screen, and all of those, combine together to make it not a very nice condition.
Okay, let's have a look at the next one. So again, hypertension, stroke, coronary heart disease, or anemia. Our first clue, Lynn.
Okay, so this condition results from an interruption in blood supply to a specific organ. Okay, I'll just say that again, from an interruption in blood supply to a specific organ. Okay.
Next clue.
And risky factors can include high blood pressure, atrial fibrillation, and smoking.
So Sophia is straight in again, saying B, stroke.
Stroke. I feel like Sophia's been revising her conditions and she knows them well. Let's have a look. Symptoms of this condition include sudden weakness on one side of the body, difficulty speaking, and vision loss. Anybody else want to pitch in with anything different or see if they agree with Sophia? And our last clue is it can be classified as either ischemic or, well, Liz might have to get you to say that.
Ischemic or hemorrhagic.
Hemorrhagic, that's it,
Yeah.
thank you. Depending on the cause.
So ischemic is a starvation of blood flow and oxygen. Hemorrhagic means a bleed.
Hemorrhagic, yeah, depending on the cause. So C Vargas class coming with C, but I think they might be talking about the first one because we've got a bit of a delay with them. Yeah. So shall we see if Sophia's right with B, stroke? Absolutely, yes. Well done. We'll give you a round of applause for that. Excellent.
So just to be clear, an ischemic stroke would happen if the blood supply was blocked. So the blood flow can't get to the brain tissue. Hemorrhagic happens if there's an aneurysm that ruptures, so a bleed in the brain, which means that the blood can't get to the brain tissues. Okay, again, so stroke, hypertension, coronary heart disease, or anemia. First clue, Lynn.
Let's have a look. This condition affects the blood and can lead to reduced oxygen transport. Okay. So reduced oxygen transport because of this condition. Common causes include iron deficiency, vitamin B12 deficiency, or chronic illness. So that's caused by those things.
Sophia is straight in again. Oh, and Khadija. Hi, Khadija. Nice to see you. They're saying D, anemia here.
Okay. I think they might be on the right track here. Let's see if this clue confirms that. Symptoms include fatigue, pale skin, and shortness of breath.
I think they're correct.
C Vargas class, absolutely correct on the last question. Let's have a look at this last one. This condition is diagnosed through a low hemoglobin level in a blood test.
Yeah, absolutely right. Well done. Okay, I think it's fairly obvious what the last one is, but let's check the clues to make sure. So clue 1, Lynn.
Yeah, it's often called a silent killer due to its lack of notable symptoms, which is really interesting, isn't it? It increases the risk of heart attack, stroke, and kidney disease. So it's very much linked to those conditions as well. Its blood pressure readings consistently above 140/90 and are used for diagnosis. Okay. And this condition is commonly known as high blood pressure. And I think we all know that high blood pressure is also known as hypertension. So well done, everyone.
Brilliant.
And shout out to Miss Linda's class with Halima. Well done, everyone. Everyone got that one.
We've given ourselves only 6 minutes, Lynn, to do the respiratory system. So let's move quickly.
Okay. This is a nice one, though. This should be relatively quick. I might give people a clue to start off. So there's a code here. We want you to put the stages of ventilation in order. Okay. So having a look at all those clues on the screen there. What is the order that ventilation occurs? We'd like you to start with the resting position. Okay, and if you consider yourself sitting down and you're resting, what would be the first thing that you might do once you've rested? So you sat down, and then what might you do ready to go? So think about that. What order would you put these in? If you could just list them, starting with B, what order would you list the ventilation process? So
I,
give
I
everybody a
always say to
second.
students when they're writing anything about ventilation to just take a moment to focus on their own breathing, maybe put their hands on their ribs and just
Yeah,
kind
nice.
of do it to remind yourself
Yeah,
what is happening.
absolutely. And you could even think about your starting and end points and then fill in between.
Yeah. So if I just read out the resting position, it says the diaphragm and intercostal muscles are relaxed and no air is moving. So remember, your diaphragm is that flat, like muscular dome, just at
Yeah.
the underneath your rib cage, and your intercostal muscles, they're the muscles in between your ribs.
Okay, we've got some lovely answers coming in here, and a little bit of agreement up until we get to a certain point. So, Anima is going to say you start with resting, and then you inhalation starts, and then inhalation completes. Okay, and then exhalation starts, then exhalation completes, and then you reset. And then back to the resting position. Does that sound right to you? I
That
think
sounds
if we
good to
can
me.
unjumble them,
Yeah.
and absolutely, that's the ventilation process, which we
So
should all be familiar with because we do it
yeah.
every day.
Yeah, yeah, but we don't necessarily know what's happening inside, do we? So when we
No.
start inhaling, your diaphragm goes from being a dome, sorry, I'm not very good at this bit, to flattening like that. And your rib cage lifts, and you can feel that if you put your hands on your chest. And then your lungs fully expanded, which means that the air flows in. And then you start exhaling, your diaphragm relaxes, your rib cage lowers down. You can feel that if you've got your hands on, and that pushes the air out because your lungs are contracting. And then you reset to that starting position. Well done, everyone.
Absolutely. And the process that you could describe there. So we have a true or false now, a couple of these. So true or false, I want you to just write T or F in the chat, okay? So our first question is, the air passages in the nose warm, filter and moisten incoming air. So the air passages in the nose warm, filter and moisten incoming air. Is that true or false? Oh, people straight in with true.
Well done, guys.
Liz, we've got some really quick typers today. That's good. Helps keep us on time. Well done, everyone.
Okay, next one.
Yeah, so true or false, the trachea is lined with ciliated epithelial tissue that helps trap and move mucus and debris away from the lungs. Is that true or false? Okay, the trachea. Is that true or false? So Khadijah's saying false. Anyone else want to have a go?
I've got a lot of falses.
Okay, let's reveal our answer. It's actually true. That is the rule, the trachea.
So from where you breathe in through your nose, you've got ciliated epithelial tissue all the way down, and it's kind of like cells with little hair-like protrusions on them, and they're stopping bad stuff getting into your lungs, because if you get debris or mucus, things like that in your lungs, it can cause a serious issue. Obviously you want to keep mucus out of your lungs. It's also why we have a cough reflex, to try and get these things out so we're not actually taking them down into our lungs. Let's do the next one.
Brilliant. So the bronchi divide into smaller branches called alveoli, which are responsible for gas exchange. Is that true or false?
And be careful with this one, because I think some parts of this are true and some parts of it are false. So
Okay.
does the bronchi go straight into alveoli? What do we think? This is a little bit of a trick question here. Manima saying true, Khadija and Sophia saying false.
False. Yeah.
Shall I reveal? So it is false, and then I've got a little explanation for you guys. So the bronchi divide into bronchioles, not the alveoli. So the alveoli are the very last thing. But the alveoli are responsible for gas exchange, which is why there was a little bit of like, oh, I think that's true. Oh, I'm not sure. Good news is you don't get questions like this on your exam paper, just from mean people like Lynn and I.
Yeah, we just wanted to give you a little bit of thinking hard today.
Okay, number 4.
The alveoli are surrounded by capillaries to facilitate oxygen and carbon dioxide exchange. Is that true or false?
So remember, capillaries are those really tiny little blood vessels,
Yeah.
and oxygen and carbon dioxide exchange, gas exchange.
Change, which we've just spoken about.
Yeah, everyone's coming through with a true. Well
True.
done, guys. Yeah,
Yeah, well done.
it is
There was a bit of a
true.
hint to that, wasn't there, in the first
Yeah.
question?
Okay,
So
last
well
one
done,
of
everyone.
these.
And then our last one, ciliated epithelial tissue in the respiratory tract increases oxygen absorption by the lungs. Is that true or false?
So think about what I said about ciliated epithelial tissue
Yes.
and its role. Is it
And
about
question
oxygen
one.
absorption, or is it about something else?
Okay. I'm not sure if these are truths from the last question or this question.
Okay,
Shall we have a look?
Manima's saying false, which is
Yeah.
right, it's false. So
Yeah.
the role of the ciliated epithelial tissue is to trap and move particles, not absorb oxygen.
Yeah.
Okay.
Just keep all those nasties out of our lungs.
So this is our last activity. So it will take us a little bit over time, but not too bad. We're going to give you 60 seconds, and you need to work out if these statements are describing COPD or asthma, or could be describing both. Okay, so we want COPD only, asthma only, and then both. So to answer in the chat, maybe put COPD and then put the numbers that relate to that, then put asthma and the numbers that relate to that, and then both and the numbers that relate to that. We're going to give you 60 seconds. May or may not have music. Should have music, but I don't know. So let's have a go.
Take it away.
Okay, so keep typing your answers. I am going to reveal them,
Yeah.
Nolan, because we are over time. So,
Yeah, let's have a little look.
so COPD is primarily caused by smoking. It can be caused by other things like occupational, that means at work, so occupational exposure to certain types of dust or chemicals, but smoking is by far the most common cause of COPD. It is a progressive condition, it's not reversible, so the harm that it does to the airways cannot be reversed. It can be managed, but it can't be changed. And frequent infections are a really common complication in COPD patients. Then if we look on the other side, asthma, that's reversible airway narrowing. So in asthma, the airways narrow because of allergens or exercise, but you can reverse that with treatment. And typically it starts in childhood, whereas COPD tends to be mid to late adulthood, but can be earlier onset if you, depending on your occupation and your smoking status. And then in the middle, in that grey bit where the two circles overlap, those are the things that are common to both. So both asthma and COPD can be managed with inhaled steroids, and they both cause the symptoms of wheezing and shortness of breath.
Well done.
Yeah, well done, everyone. Let's have another round of applause and an air horn.
I'm ready an air horn. Yeah.
Fabulous revision on cardiovascular and respiratory system. So there's no more Unit 3 revision this week, but we will be back next Tuesday, same time. I can't remember off the top of my head what we are revising, but it'll be another two body systems. Thank you so much for joining in, especially if you've joined with your whole class. It's brilliant to have you with us. Thank you so much. See you again soon.
Thanks, everyone. Bye.
Bye.